So we're going to do this over, roughly speaking, about 20 minutes, and that'll be followed by some personal experiences from Elaine and Shani. And then there's also another talk after that from Dinah, who's going to tell us a little bit more about how to cope and coping strategies around COVID-19. So the way we're going to do this is to actually just show you some results, and then and Ciara and I will discuss it, and we'll move on, and hopefully we'll cover this in the next 20 minutes. So what this survey was basically an electronic survey, which was done initially in August 2020, and then this was repeated more recently in April this year. And we've had about 125 responses, but what we're going to share with you is the first 100 responses as far as the results go. I think this is an amazing sort of response, which is quite a big number. But this was the first slide, Ciara, which shows the representation in the 2020 survey versus the 2021 survey. And you can see, I guess, how things have changed over here, that we have not just people from the UK and the Republic, but also people from a bit further afield. So I wonder how this happened. I think is probably, I think Corinne is also there somewhere, but I think it must have been maybe disseminated much more widely. What do you think, Ciara?
Yeah, no, I totally agree. It's a much wider field than what we had in the first survey. And great to see, like you said, I recently tried to host a survey and I didn't get half as many responses. So I think the next time I'll ask Corinne to do my surveys.
So, yeah, so there are a number of different places who answered. And it maybe changed slightly, but that's as far as the numbers go. Let me move to the next slide. So, this is a description of who completed the survey, and you can now see the different people who have completed the survey. So on the left side is whether it was a parent or the carer, and then the blue bit is the individual. The blue bit is the parent or carer, and the red is the individual. And then the middle panel over there, the pie chart, gives you an idea of the number of people or the age groups of the people who responded. And you can see, I guess, as you might expect, most of them are adults. And the right chart over there, pie chart, shows you the severity of the osteogenesis imperfecta. Would this kind of reflect, the pie chart on the right, Ciara, would that reflect your clinic load, do you think?
Yeah, I thought that was very interesting, you know, because there seemed to be an equal share between the mild, the moderate and severe. We're a growing clinic. We probably have over 100 families now. And yeah. I would have thought that we would be 2/3 mild and then sort of maybe 20% moderate and then 10% severe. But I think it plays to Brittle Bone Society the fact that they attract all types of severity, all levels of severity of OI, you know, so part of the membership, really.
Yeah. It's also interesting that there's a small number who are unsure about the severity, and I think that's not unusual, because sometimes you just don't fit into one particular bracket. So I guess that's as that goes. So what are the risk factors for COVID vulnerability? Now, you will know that, this has gone past. What are the risk factors for COVID vulnerability? Well, these are listed over here, and these are the ones which are the official sort of risk factors, and it gives you an idea of the people who responded, whether they had any risk factors. And you can see that, again, you know, a lot of them did not have any risk factors at all. And then there are a few quite a few who got risk factors, and the commonest one is severe scoliosis. And the pie chart at the bottom over there gives you an idea of the fact that how many people had more than one risk factor. And you can see possibly a quarter of them had more than one risk factor. Was this something you were, people asked you about, Ciara, whether do I have a risk factor, or maybe some people who didn't have a risk factor were worried about?
We had a lot of conversations about it at the start, and in particularly we have quite a growing group of sort of baby OIs, young children with severe recessive OI, and they're on respiratory support for the first couple of years of life, maybe just some oxygen, high flow. We were very nervous about that group. And thankfully, despite the fact that family members, in a lot of them, contracted COVID, not one of our kids, touch wood so far, has done so. So we haven't been challenged in that regard. My experience overall with children is that they tolerate COVID very well. So I think a year in, I'm a bit more relaxed about it. But then I think it would be the adults that have the issues with scoliosis and not the children. And I think that group would be the group that, I think it reflects our adult group, and maybe Kasim might find that they're more at risk. But from a childhood perspective, I would have said no.
Yeah, and I think it's really quite useful to have this, because you can actually see that the Brittle Bone Society actually did some preemptive work here, because they had the information on their website and about the kinds of things, the kinds of people with what kinds of conditions would be vulnerable. And so severe scoliosis and chronic respiratory disease are one of the two commoner ones. So it was good to have that information there.
And did you have the same experience in your clinic, Faisal?
We had people ringing up with lots of questions about whether they are vulnerable and things. So we were going along with the official advice, and we were also directing them to specific websites for different conditions. So for osteogenesis imperfecta, we were sending the Brittle Bone Society. And I think it was quite useful for the Medical Advisory Board to actually come up with some information on that. So I think I think it worked well, but maybe there'll be stuff in the Q&A which we can cover. And then so into nitty-gritty of the health delivery itself. So you can see this was asking whether any appointments were postponed. And I think last year when we did this, I think we possibly had more appointments which were postponed.
Agreed, especially at the start.
Yeah. And I think things seem to have possibly changed a bit, but you can see that there are certain appointments, possibly to the allied health professions, which seem to have been reported to have been postponed more. But maybe that's just a marginal thing. And effectively half of it, roughly speaking, sounds like appointments were postponed. And it's interesting that the scans were not postponed. And that's contrary to our own experience. I don't know, Patricia, Ciara, what you think, but we had difficulties getting scans done in our hospital.
That's been our biggest delay. And I think going across, we managed in the second half. So I think the time that this survey covers, which is more Christmas to now, we have managed better with the appointments, despite the fact that we've actually been on level 5 restrictions until 2 weeks ago. Less well with the AHPs and even less well with the scans. So it's disappointing to see that people are struggling with the scans. I mean,
the appointments with consultants just became more remote, but so they were managed. But the scan appointments, I guess they were out of the control. And
I think the number of scans you can do in a day
therapy, have you had any OI related? Have you had any OI related therapy altered due to COVID-19? There's quite a lot of information here, so I'll try to be as slow as I can. So medical therapy changed due to unavailability. So that presumes that's the question which was posed. So this is medical therapy possibly not available because there was no, it wasn't, but you could see that in most cases that was not the case. Therapy changed to avoid coming to hospital. And that sounds like, kind of roughly speaking, 50-50. There are people obviously who went on any therapy. And then the day unit therapy changed. And again, 50% of the people said, no, it wasn't changed. And the rest of them said either, a small number said it was changed. So I think that, what do you think? I mean, I think this is quite positive that the day unit therapy didn't change so much.
I think we're in a better place now. I think people are able to access the services much better now. Lisa Mills has just made an important point in the chat, which was in the back of my mind, which was that the delay in allied health maybe reflect the number of staff who are redeployed to support patients with COVID. And I think in the adult services, that's probably very true. And in our community services, there was a lot of redeployment. But thankfully, in paediatric services, we managed to hold on to our AHPs in the hospitals, but not in the community.
Yeah, yeah. So I would be interested to know whether the pediatric people were redeployed into helping adults, because I think in some hospitals that happened as well. In some places, I think pediatric services were protected, but I think in some places they were less protected. Certainly when people asked me whether I would help on ITU in places, I said yes, but the last time I actually put a stethoscope on an adult chest was about 30 years ago. I think that was a kind of a hint to say, yes, but possibly no.
I also said, yes, I'd be more than happy to be redeployed, and spend 3 months going, please, please, please don't redeploy me. No, we moved our pediatric service out of the adult hospital to give them space to work, and we stayed in the pediatric only hospital. So that's how we managed. So.
Okay. Have you had any OI-related therapy altered due to COVID-19? And this is related to surgical therapy. So this is about whether if you had any either planned procedures going on, or whether you were presenting with an acute fracture. So the first question was really, did you avoid coming to hospital with a suspected fracture? I thought that was a really good question to ask. And you can see that quite a few people did not avoid coming to hospital with a suspected fracture, but there was a proportion who did not come, who would have come to hospital but didn't come. So, and I guess that just reflects what we've been seeing in casualty, I guess, Ciara. But yeah, and I was thinking maybe this is a positive thing, because then it means that people might have developed better ways of dealing with fractures at home. I don't know what you think about that.
Yeah, I think when I looked at it first, I said, is that quarter pie that's not applicable, the people who didn't have a fracture in the period of time, which suggests there was quite a lot of fractures going on, and that, you know, the number who avoided coming is, again, less than a quarter. I hope that they were able to manage at home. I'd be interesting, and this goes back to the future talks, about what their coping strategies are now for dealing with fractures and whether or not they have changed.
Yeah, and it would be really good to learn from those people, actually, as to what they did, because that would help in the future.
I just wouldn't like to think they were at home in pain, would be my only caveat on that.
And then about surgical procedures cancelled or postponed. So you can see that in a significant proportion, they were postponed and cancelled. And that's been something which has really affected us, and I think is going to affect us for a while in our service. I don't know what's happening here in Dublin, but over here, elective surgery is almost nowhere to be seen at the moment.
Yeah, again, the amount of cases they can do in a day has been disproportionately reduced, and then the priority has been given to emergence, so all the neurosurgery and everything, leaving very little space for anybody else. So we had a lot of people psyched up and, you know, prepared to have major surgery that's had to be deferred, and that's very tough, very tough.
Yeah. So then another important area is, of course, mental health and well-being, and we'll be covering that later as well. So this gives you an idea. So there are two pie charts here. So one is struggling with mental health, and the other one is struggle with not seeing friends and relatives. Actually, personally, I've had a great time. I've just been at home gardening, but I think you can see that a lot of people have struggled with not seeing friends and relatives, and then the other part is people struggling with mental health, and you can see that quite a few people have. Ciara, I just don't know and I think people can tell me more and can tell us more, because I don't know what the baseline was. So I don't know how many people actually with osteogenesis imperfecta struggle with mental health, and I don't know how much that changed because of the pandemic. Do you have a feel for that at all? And
Yeah, I mean, interesting enough, if you ask me personally to reflect on this, I would have hit every color on the first pie chart at some stage in the pandemic, and I think a lot of
Yeah,
people would align with that, because especially in the winter, when it was difficult to get out, so even just being able to wave at people from a distance, and that became harder. I found everybody got a bit more down. The second one, I think,
yeah,
just validates how much we need people around us. The struggling with not seeing friends and relatives, you can see that was a huge impact on everybody. And while Zoom has been useful, I don't think it replaces people contact, and that's, as humans, what we thrive on. So, but I
yeah,
don't think we have a baseline. I mean, like you said, what you need to do is repeat this when we're all back out in the community again, and see what people say, and then reflect on what level is baseline for OI versus OI in times of COVID.
yeah, yeah. That's a good idea. Yeah. But it gives you an idea. It tells you that most people did have problems, and I think that's an important thing to bear in mind. Just going into, we've got just a few minutes left. So just about remote consultations. So this was just checking. So have you received remote consultations during lockdown? And I've just put the results from 2020 and 2021 in perspective. And you can see more people are now have received remote consultation. So I guess that's how we expected it to happen. It took a while for those things to go. And then was this consultation via telephone or video? And you can see over here that most people have had consultation by telephone as opposed to video. And again, you'll see often it's also been a combination of telephone and video in the other slide. How are things going in Dublin? Are you telephoning and videoing, or is it?
Yeah, so I mean, we use Attend Anywhere now, and a combination of Teams or Zoom for non-patient contacts. So the Attend Anywhere took a while to set up, but our physios particularly have really enjoyed doing that with the families. And our dentist does a great combination of sending in photos in advance, followed by an Attend Anywhere, which is great. I'm very impressed with that.
Yeah. Yes. I think the last time we did it, I think a few people didn't know what Attend Anywhere was, but I think it's really taken on. And So going forward, really, would you prefer a remote consultation rather than a face-to-face visit? And that was quite a clear question there. And you can see that about a quarter said no, they would prefer a face-to-face visit. But about a quarter, just over, actually said yes, they would prefer it. And the greens are sometimes. So I think going forward, sort of things like telephone and video are going to take on. I think there is acceptance for this, which is good, isn't it? What do you think? Have you had the positive?
Well, I think your cohort is like mine, Faisal. A lot of people come very long distances to see us. They come from all corners of Ireland. And I often feel that I've wasted people's time when they turn up and everything is fabulous. They haven't had any fractures. They're in good health. School is going well. And I do feel now that we could do these consultations and then arrange face-to-face for the people who need to see us, or for the people who specifically request a face-to-face. So the hybrid idea appeals to me going forward, especially for family convenience.
Yeah. I think, well, I know Kazim's going to cover most of these issues as far as remote consultation goes into in more detail later on today. So I think we've just kind of effectively set the scene for the rest of the day, hopefully. So I've just made some summary points over here. So I think it's clear that the pandemic has had an impact on the care of people with OI. I'm not clear whether this will have any long-term effects on the health of people, but I think it would be very, very useful if the Brittle Society did this survey again sometime in the future, because that will give us an idea of what's happening. And then I've also put down, I think there've been some change, some things will change. I think remote consultations, I suspect, are going to be here for good, but not on a compulsory basis. I think people will be given a choice. to say, would you prefer to come and have your discussion by remote consultation? And some people will say yes, I suspect. But I think we've started giving choice to people. Ciara, I don't know what's happening in your setting.
Yeah, no, we're definitely trying to. Actually, a couple of comments on the chat here. Neve O'Brien, hi Neve, has also agreed with us, saying giving families the choice close to the time of the appointment would be great as to whether remote or face-to-face is needed. And I think that would be something that it's a real life thing that we can offer. And Sally had actually put up with our previous slides, just saying there that that in terms of fractures, that she does her best to manage them at home, but attending hospital during the time of COVID overrode her concern about her fractures. But again, I think that's something I don't know how much time you put into. We've thought a lot more about what we could give to families to manage a fracture at home so that they didn't have to come in. And I didn't do that well enough before this, and I'd like to do that better now. So it has made us think a lot more about home-based management. You know, it was too easy previously to say come to ED. Now we need to think about how not to come to ED, and I think that would be progress too.